Hey everyone, looks like we're going on a deep dive today into the world of colon polyps and colonoscopies.
Yeah, it looks like someone's been doing their research.
We've got medical handouts, a podcast episode, even some pretty thorough instructions for getting a colonoscopy.
Wow, the whole 9 yards.
Sounds like somebody is either prepping for a colonoscopy or just really wants to know more about colon health.
Either way, they've come to the right place.
All right, so let's jump right in. First things first, what exactly are colon polyps?
So you can picture your colon, right? Like a pipe, smooth inner surface.
Okay.
But sometimes little lumps of tissue start growing on that surface. We call those lumps polyps.
So just little bumps. Is there like a way to visualize it?
It's kind of like, imagine you drop a bit of pancake batter on a griddle.
Uh-huh.
So some polyps are flat and spread out, kind of like that batter. We call those sessile polyps.
Okay.
And then others grow on a stalk. So they look kind of like tiny mushrooms.
Oh, I see.
Those are called pedunculated polyps.
Okay, makes sense. Now, the material mentioned that the sessile polyps, the flatter ones, are harder to spot during a colonoscopy.
Right, exactly. And that's why a really good colonoscopy prep is so crucial.
Really cleans things out.
Exactly, yeah. Got to make sure the doctor has a clear view so they can catch even those sneaky flat polyps that might be hiding.
That makes sense. Okay, so I get why they want to find the polyps, but why remove them? Like, most of the material says that most polyps are actually benign.
Right. It's a good question. And it really gets to the heart of why these colonoscopies are so important.
Okay.
Because while most polyps do start out benign, they have the potential to turn cancerous over time.
Oh, I see.
Yeah, and almost all colon cancers actually start as a benign polyp.
So they're like a ticking time bomb.
Kinda, yeah. But the good news is that when caught early, which is where that colonoscopy comes in, they're easily removed.
Okay.
And then they pose no further threat.
Okay, so it's really a preventative thing.
Absolutely. It's a way to catch it before it becomes a problem.
All right, that makes it sound much less scary.
That's good. And it's even more effective when you consider that not all polyps are created equal.
Right, because the handout mentioned a few different types.
Mm-hmm.
Can you break those down? Which ones should we be most concerned about?
Sure. Let's start with the least worrisome inflammatory polyps.
Okay.
And these actually aren't true polyps, but they're more of a reaction to inflammation in the colon.
Oh, interesting.
They often show up in people with conditions like Crohn's disease or ulcerative colitis,
Okay.
but they don't usually turn cancerous.
So those are kind of the false alarms of the polyp world.
Pretty much, yeah.
What about the others?
Well, you've got hyperplastic polyps. They're super common,
Yeah.
especially in the rectum. Tiny and generally low risk.
Okay.
Now, the most common type you'll run into is the tubular adenoma.
Tubular adenoma.
They make up about 70% of all polyps removed.
Wow.
They don't usually cause symptoms, but they do have that cancer risk, and that risk increases with size.
So size matters.
In this case, yes.
Okay, so those are the main ones.
There's a couple others. We've got serrated adenomas.
Okay.
They kind of have this distinct sawtooth appearance under a microscope.
Bliss.
Less common, but they might develop into cancer more rapidly.
Uh-oh.
And finally, there's the villus adenoma.
Villus adenoma.
This one has the highest risk of turning cancerous, and they can be tougher to remove. Sometimes you need multiple colonoscopies or even surgery.
Wow. Okay, so a whole spectrum of polyps out there. Now, sometimes these biopsy reports, I've seen the word dysplasia, and that always sounds a bit scary.
Right, I can see why.
Can you shed some light on what that means?
Sure, dysplasia can sound alarming, but it's important to remember it's not cancer.
Okay, good.
Think of it kind of like an abnormal pap smear.
Okay.
So it's a precancerous change in the cells, a warning sign that needs attention, but it's not a full-blown malignancy.
So like a heads up, but not a guarantee.
Exactly. And just like polyps, dysplasia is graded.
Oh, so there's different levels.
Yeah, low grade means the changes are mild, while high-grade dysplasia means there are more significant abnormalities.
I see.
But regardless of the grade, it's a serious finding that warrants close monitoring and follow-up.
Okay, so that's reassuring to know. So if we find out we have polyps or even this dysplasia, is there anything we can do to prevent them from developing in the first place?
That's the million-dollar question. Unfortunately, there's no foolproof way to prevent them entirely.
Darn.
But there's growing evidence that a diet rich in fiber, calcium, and folic acid may help reduce the risk.
So loading up on those fruits and veggies, not just good for our overall health, but maybe protecting our colons too.
Exactly. And remember, The best way to minimize your risk of colon cancer is through regular colonoscopies,
Catching it early.
right? Allows for early detection and removal of the polyps before they have a chance to turn into cancer.
That makes perfect sense. Speaking of colonoscopies, I know a lot of people find the prep to be the most daunting part.
It's understandable, but thankfully, the days of chugging gallons of awful-tasting liquid are fading away.
Oh, good.
There are newer, more tolerable options available, like low-volume preps and even pill-based alternatives.
Much better. So why is the prep split into 2 doses?
Well, it's all about getting the clearest view possible. The first dose cleans out most of the colon, but then, overnight, your small intestine keeps working, and its contents can empty into the right colon, which could block the view for the doctor.
Makes sense.
The second dose, taken a few hours before the procedure, makes sure that area is squeaky clean.
So it's like a 1-2 punch for maximum colon cleanliness.
Exactly.
Okay, so then what about the procedure itself?
You'll be given sedation, so you'll be comfortable and relaxed throughout the procedure. The doctor uses a long, flexible tube called a colonoscope. It has a tiny camera on the end to see the entire lining of your colon. And if they find a polyp, they can usually remove it right then and there,
Just like that.
using a tiny wire loop called a snare.
That sounds much less intimidating than I imagined.
Good, good.
So what about afterwards? What's the recovery like?
You'll spend a short time in a recovery area while the sedation wears off. You might have some gas and bloating from the air used during the procedure,
Yeah.
but that's totally normal and usually goes away pretty quickly. You'll also need to avoid driving or operating machinery for the rest of the day.
Okay, so not exactly a spa day, but manageable.
Exactly.
Now, there's got to be some special considerations for people with certain health conditions, like diabetes or those on blood thinners, right?
Absolutely. If you have diabetes, you'll need to work with your doctor to manage your blood sugar during the prep and adjust your medications as needed.
Mm-hmm.
It's also super important to give them a complete list of all your medications, especially if you're on blood thinners, because some might need to be adjusted before the procedure.
Makes sense. The instructions mention COVID-19 precautions too.
Yeah, if you have any symptoms or recent exposure or have had COVID-19 in the past 4 weeks, it's important to reschedule your colonoscopy just to keep everyone safe.
Of course. Now, one thing that really stood out to me in all these materials was the alarming rise of colon cancer among young people.
You're talking about how millennials are at a much higher risk compared to previous generations.
Yeah, it's a bit unsettling. The current guidelines recommend starting colonoscopies at age 45, but with these trends, it makes me wonder.
It raises an important question. Even though the general recommendation is 45, should you be talking to your doctor about colon health sooner, especially if you have any risk factors or a family history of colon cancer?
It's definitely something to think about. It's kind of mind-blowing, right, that colon cancer, something we think of as an older person's disease, is now affecting younger people more and more.
It really is. It challenges those assumptions we have about colon health.
And it's not just like a little increase. The materials we have, say millennials, have twice the risk of getting colon cancer compared to folks just a few decades older.
It's a pretty significant jump.
So what's going on? Why are millennials seeing such a huge spike in these rates?
That's the big question, isn't it?
Yeah.
And there's no easy answer. Seems to be a lot of factors at play, like changes in lifestyle, diet, environmental things, even changes to the gut microbiome.
Wait, the gut microbiome, the bacteria in our intestines.
Yeah, exactly. And it actually plays a huge role in our overall health, way bigger than we thought. It affects digestion, immunity, and it seems even the risk of getting certain diseases. There's more and more evidence that disruptions in the gut microbiome, maybe because of things like diet and antibiotic use, could be tied to this increase in colon cancer risk.
So even little things like what we eat and the medications we take can have consequences down the line for our colon health.
It really highlights how connected everything is in our bodies.
Yeah, it makes you think twice.
And how even small choices can have a big impact on our risk for different diseases.
So while researchers are trying to figure out the root causes, what can we do in the meantime? It's kind of like waiting for the other shoe to drop.
I get that feeling, but it's definitely not a time to just sit back and do nothing. With these trends, being proactive about colon health is more important than ever, even if you're younger than that recommended screening age, especially if you have any risk factors, like a family history of colon cancer or polyps. Your doctor can help figure out your individual risk and what you should do.
Okay, good to know. That brings us back to the colonoscopy. It can be a daunting procedure, but Like we've learned, it's a key tool for preventing colon cancer.
Very true. And even though the prep might not be the most fun experience, it's worth it for peace of mind and the potential for early detection, which could really save your life.
And like you said earlier, there are better prep options now. No more chugging gallons of that liquid.
Exactly. And advances in sedation have made the procedure itself much more comfortable.
That's good to hear. What about the cost, though? A lot of people are worried about how expensive a colonoscopy can be.
I know that's a valid concern. Like we talked about before, there can be a few different fees. But the good news is many insurance plans cover screening colonoscopies, especially if you're at average risk. It's always a good idea to check with your insurance provider to see what they cover.
Great point. So if colonoscopies are our best defense, are there other things we can do to lower our risk of developing polyps or colon cancer in the first place, like besides just getting screened?
Absolutely. We can't totally eliminate the risk, but we can do things to improve our odds. And yep, you guessed it, diet plays a huge role.
Back to the food.
Research shows pretty strongly that a diet high in fiber, calcium, and folic acid can help reduce the risk of colon polyps.
Okay, so break it down for us. What are the foods we should be eating more of?
Think fruits, vegetables, whole grains, legumes, all those good-for-you foods we know we should be eating anyway.
So basically, load up on the produce and ditch the processed junk.
Exactly.
Gotcha. But why are those foods so good for our colon health?
Fiber is a big one. It keeps your digestive system running smoothly by adding bulk to your stool and helping things move along more efficiently. And that can potentially reduce the time those harmful substances spend in contact with your colon.
Interesting. So it's not just about what we eat, but how quickly things move through our system.
Right.
What about calcium and folic acid? What do they do?
So calcium, which you can find in dairy, leafy greens, fortified foods, might also help protect against colon cancer, though we need more research to figure out exactly how. Folic acid is a B vitamin that's super important for cell growth and repair. And you can find that in leafy greens, citrus fruits, and fortified cereals.
Okay, so colorful plate full of nutrient-rich foods is the way to go.
Yep.
What about foods we should avoid? Are there any dietary villains when it comes to colon health?
There are definitely some things to watch out for. Processed meats like bacon, sausage, deli meats have been linked to a higher risk of colon cancer. Red meat is a good source of protein and iron, but it's best to eat it in moderation.
So it's all about balance.
Right.
Okay, what about other lifestyle factors? I bet exercise and stress levels play a role too.
You're absolutely right. Staying active and maintaining a healthy weight is crucial for overall health, and that includes colon health. Physical activity helps keep things moving, reduces inflammation, and just makes you feel better overall.
Got it. Get moving and ditch the couch. What about smoking and alcohol? Do those impact colon health?
Smoking is a big risk factor for lots of cancers, colon cancer included. Quitting smoking is one of the best things you can do for your health, period. And alcohol, moderate drinking is generally okay, but excessive drinking can increase your risk.
So moderation is key with the alcohol.
Yes,
What about stress? It seems like chronic stress is at the root of so many health problems these days.
I hear you. Stress can really mess with your body, including your digestive system. The link between stress and colon cancer isn't fully clear, but it's always a good idea to try to manage your stress levels. Things like exercise, meditation, spending time in nature can help.
Taking care of both our physical and mental health, they're so connected.
Exactly. And speaking of connections, there's one more really important aspect of colon health we should touch on. Family history. If you have a close relative who's had colon cancer or polyps, your risk goes up quite a bit.
So knowing your family history is crucial.
It is. Be sure to share that info with your doctor. They can recommend personalized screening based on your individual risk. So someone with a family history of colon cancer might need to start getting colonoscopies earlier or get screened more often.
It sounds like it's all about a personal approach, not one size fits all.
Exactly. And while a family history of colon cancer can be scary, remember that knowledge is power. By understanding your risk and being proactive, you can take steps to lower that risk and prioritize your colon health.
Okay, so we've covered a lot of ground here, from diet and lifestyle to family history and personalized screening. It's a lot to take in.
It is. It's a lot of information.
But I feel like I'm starting to get a clearer picture of how to take care of my colon.
That's great to hear.
What's the main takeaway for our listeners? What do you hope they'll remember?
The most important message is this. Colon health is not something to ignore. It's about being proactive, understanding your risks, making healthy choices, and working with your doctor to create a plan that keeps you healthy.
It's about taking charge of our health and being our own best advocate.
Colonoscopy is still considered the best way to find and remove
The
polyps.
gold standard.
Yeah. But researchers are always trying to find less invasive, more convenient options.
Right, because the materials we have mentioned, these stool-based tests, that can check for blood or DNA changes,
Uh-huh.
and those seem a lot less intimidating than a full-blown colonoscopy.
They definitely are. And for some people, those stool tests are a good option.
Yeah.
Folks who can't have a colonoscopy. But it's important to keep in mind that they aren't quite as sensitive.
Okay.
They might miss some polyps or cancers that a colonoscopy would catch. But we're here to figure out if these new tests are really all they're cracked up to be.
A very valid question. Let's break it down.
So Garden Shield is a blood test, and Cologuard analyzes a stool sample. Both are vying to be the go-to alternative for colon cancer screening.
And, on the surface, they seem pretty similar, right? They're both marketed as being super accurate at detecting colon cancer.
Yeah, Garden Shield boasts a 99% accuracy rate when it comes to ruling out advanced cancer.
And Cologuard claims a 92% accuracy rate overall. Pretty impressive numbers for sure.
But here's where things get a little tricky. They both have some pretty significant limitations.
Okay, I see where you're going with this.
How can these tests be so accurate but still have these drawbacks? What's the catch?
You hit the nail on the head. The catch is neither test can actually prevent colon cancer.
Wait, so they can detect cancer but not prevent it?
Right, they're looking for signs of cancer DNA that's already present in the body.
So in theory, you could take one of these tests and it could come back positive, but the cancer might already be pretty advanced.
Exactly. And at that stage, treatment options become more limited, and the prognosis might not be as good.
That's a stark contrast to a colonoscopy,
Yeah.
which can actually prevent colon cancer.
Absolutely. Colonoscopy is the gold standard for a reason. During the procedure, doctors can see and remove precancerous polyps.
Polyps. Those are those little growths in the colon, right?
Yep, polyps are small bumps that can form on the lining of the colon. And while not all polyps are cancerous, some can turn cancerous over time.
So by removing them during a colonoscopy, you're essentially preventing cancer from even developing.
Precisely. That's the power of a colonoscopy. It's not just about detection, it's about prevention.
And that's where those newer tests fall short.
Right. And there are some other important nuances to consider.
Like what?
Well, take Garden Shield, for example. It can miss a significant percentage of early stage colon cancers, something like 35%.
Whoa, that's a lot.
It is. And those early stage cancers are the ones that are most treatable.
So even though it's highly accurate for advanced cancer, it might miss the cancers that are most likely to be cured.
Exactly. And then there's Cologuard, which has a different issue.
What's that?
It has a higher chance of false positives,
Meaning?
meaning it might tell you you have cancer when you actually don't. These tests are not meant to replace a colonoscopy.
Okay, so we've talked about the pros and cons. What's the bottom line for our listeners?
These newer tests, while convenient, aren't a replacement for a colonoscopy, especially when it comes to preventing colon cancer.
So they're not a magic solution?
Not quite. They might be part of the conversation, but they're not a substitute for the gold standard.
So what should our listeners do?
The best thing to do is talk to your doctor. Discuss your individual risk factors, and together you can decide on the best screening strategy for you.
Excellent advice. Thanks for joining us on this deep dive.
My pleasure. Always happy to help shed some light on these important topics.
And to our listeners, remember, knowledge is power when it comes to your health. Stay informed, stay proactive, and stay tuned for our next deep dive.
See you next time.